Good evening. In the last few sessions, I have shared information about what is Panchakarma, the treatment principle behind Panchakarma treatments, the five kinds of Panchakarma, and their usefulness in fertility treatments. I replied to some frequently asked questions as well about Panchakarma. If you have missed any of these videos, check them out on my Fertility Ayurveda profile. I am Dr. Anupama Santosh from Shreshtha Ayurveda. Today, I'll be taking up some questions we received on direct message after the last week's session. Let me check the questions. Yeah, the first one is Hello, doctor. I have taken many other different treatments before. Will Panchakarma be harmful for me? Absolutely not. In fact, if you have taken many treatments for a long standing condition, you should consider doing Panchakarma to help detoxify and cleanse your system. Second question. Hello, I am 37 years old female and planning to do IVF since I have lost both my tubes due to ectopic pregnancy. Will Panchakarma have adverse reaction for my IVF treatment? Since you have unfortunately lost both your tubes, I can understand your reason for considering IVF. Panchakarma will actually help you increase your IVF success rates by improving your egg quality. Also helps the endometrium thickness for better implantation. Panchakarma is an intense therapy, of course, which thoroughly detoxifies but is gentle on the body with no side effects when you have done it properly. Please make sure you do it under the supervision of a qualified Ayurveda doctor. Okay. Should I take leave to do Panchakarma treatments? I have addressed this before, nevertheless. Though ideally Panchakarma is done in an inpatient setup, most often it's difficult for people to take many days off and avail the treatments. So at Shreshtha Ayurveda, we have adapted the same traditional Panchakarma treatments to be done as an outpatient. We have taken measures to make them as effective in the outpatient setup as well. You need not take leave from work. Okay. Hello, doctor. Can I do Panchakarma only on weekends? There are some treatments which can be done only on weekends, but it will depend on your condition. It is best to do the Panchakarma treatments continuously for a minimum duration of 7 days. Okay, well. Which female infertility conditions can be treated with Ayurveda? In my fertility practice of more than 2 decades now, I have used Panchakarma extensively with very good success. With Panchakarma, I have treated female infertility cases related to PCOS, endometriosis, adenomyosis, ovarian cyst, low AMH, fibroids, hydrosalpinx, obesity, and other hormone imbalances. Hello, doctor. I have irregular period. When should I start my Panchakarma treatment? I understand why this question. Last time I mentioned that for females, we usually start the Panchakarma treatment after the period. In case of irregular period, where you probably don't know when you will get your period, you can start any day and pause if you get your period in between the treatments and then restart after the bleeding stops. Namaste, doctor. I am a 42-year-old diabetic male with infertility. I want to know which male fertility conditions can be treated with Panchakarma. Male fertility issues like oligoteratoasthenozoospermia, that is low count, low motility, and low morphology, can be treated very effectively with Panchakarma. Even low DNA fragmentation index and hypospermia, that is low sperm volume, can also be treated successfully. In your case, the Panchakarma treatment will also address your diabetic condition as it can damage your semen parameters. I hope that helps. Another patient writes, I tried detoxification before but was not able to consume so much medicated ghee before the loose motion procedure. What can I do? I think the patient is referring to Snehapana Virechana procedure. If you are unable to take the medicated ghee, there are many other alternative Panchakarma treatments to get the benefit of detoxification. Nothing to worry. Do check with your Ayurvedic doctor for alternative options. Are you doing Panchakarma only for fertility? No, not at all. Panchakarma is useful for all disease conditions. There are more than 40 kinds of detoxification therapies along with the 5 main therapies which can be used effectively to treat many conditions. In fact, all of us should do Panchakarma as preventive therapy as well. Keep your questions coming. I will reply to them in the next session. Good night.